Okay, so let's see this early one you can attend, but the March, the May course will be still little more extensive. Now today's talk, part of it since yesterday you attended my lecture.
Yes, I have attended.
So this also includes the entire thing in that, but there will be something more as well. Okay, so it will be a revision kind of thing, but there will be more. So let's see now. I wish that you, at least since there are only 3 audience, so they all must benefit from this. And this is what we are going to discuss today. One is hypothesis framing, which test to use, ethics in research, the dangers of post hoc analysis, types of study, level of evidence. So this all, the words looks very frightening, but it's all I will be explaining only in simple terms. So what is the research? It's a research question, because any study if you start, basically it's based or evolves around the research question. And this is the starting point of any research. So what you were telling, first of all, that your data, you have got so much of data. So first you have to decide that what can we find out from this. So that research question, so what is your area of interest, what is not answered yet in the literature, so you have to do proper literature search for that. And then you arrive at a research question. Then probably you will be proceeding in the right direction. Yeah. So research question was these things yesterday, time was short, so I didn't elaborate. The research question should be always precise, truncated, should answer unanswered problems. So it means it should be novel, should be important and significant, means relevant, should be feasible, should be ethical and must pass the so what test. Because after all, ultimately you have to say, okay, I am going to study this and this is my research question. But ultimately you have to ask yourself that someone will ask, okay, you are doing this, so what? But then it means what is the importance of this? Where can it be applied? Now I have got 2 more audience, so 3 to it becomes now 5, and they are all hired audience. Okay? No, they are hired audience. So the importance of research lies in the importance of the research question. So basic thing is the starting point is your research question. Now for research question you have to do a proper literature search, exhaustive, because anything which has been answered before, there is no point again answering the same thing, because it's unnecessary wastage of resource and energy. Then so from the literature you find out what is known, what is unknown or controversial, and so ultimately then you will know that what is the lacunae in literature. And based on that you formulate the research question that which answer will fill that lacunae. Now just I am giving simple example. Suppose if someone will say that in the beginning I told you that it has to be precise, truncated, but say to compare the efficacy of xylitol and timolol. Is it a good research question? Means someone will say, no, I just want to compare efficacy of xylitol and timolol. No, it's not. But then slightly go on little. Oh, sorry, that was probably my secretary's mistake. The first was simply to compare the xylitol and timolol. Second data on IOP. So now efficacy on IOP. So now you have slightly introduced something more that I am trying to compare, but not about complication, not about how the patient feels about it, but about on the intraocular pressure. Then again if I say, so you have incorporated a little more to compare the efficacy of xylitol and timolol on IOP in glaucoma patients. So now you are getting more narrow and narrow. That I am not going to do on total entire population who is normal, maybe anything, but then restricting to glaucoma patients. Still, suppose if I say compare efficacy of xylitol and timolol on IOP in newly diagnosed glaucoma patients with advanced glaucomatous damage, because the same medicine will have different effect in early diagnosis or early glaucoma patients or advanced glaucoma patients. So what is the effect on this? So gradually you are trying to narrow down your research question. The more narrow your research question is, more strong answer it will give, and more important, significant it will be. In this also, that again if I further classify that to compare the efficacy of xylitol and timolol on IOP in newly diagnosed glaucoma patients with advanced glaucomatous damage in Indian population, because the effect of the same medication will be different, maybe different on Indian population, maybe different on the different race. So you are specifying. So gradually you are trying to narrow down the population what you are going to study. But then there you have not introduced any time factor. But if I say to compare efficacy of xylitol and timolol on IOP in newly diagnosed glaucoma patients with advanced glaucomatous damage, in Indian population at 3 months follow-up. It means now you are specifying that whatever I am studying, I am going to study at the end of 3 months. So effect at 3 months. So not similarly, maybe if 3 months it's effective, say 6 months also may be same effect. May not be same. But you are basically narrow downing your question. Now, so for any ideal question, after going through that example, probably the best question or the question you want to refine, then there should be 5 elements you have. It has to be there if it is an intervention trial, which goes by the mnemonic PICOT, P-I-C-O-T. P stands for population, I for intervention, C for comparison, O for outcome, and T for time. Now this is just 1 or 2 examples I am giving. In this, everything is not there, but I will just bypass this. In this, they all are from published literature. There are 2 parts of the aim of the study, but still this doesn't contain all 5 elements, whatever I told you just now. But as compared to that, just take for this example, this just 1 sentence. The aim of the study was to evaluate and compare the endothelial cell loss in phacoemulsification with ACM without OVDs as compared to that in phacoemulsification with OVDs alone in immediate post-operative period in patients with senile cataract. This is published in Indian Journal of Ophthalmology. Now, all 5 elements are there. Can you find out? Since there are only 3, can anyone tell me where is the first element? P, population. What is that population in this? Patients with senile cataract. This is what you are going to study. Now the next was I. What is intervention? What intervention is this? We are going to study. Phacoemulsification with ACM without OVD. Then third was C, P-I-C. C means comparison. Means you are going to compare this intervention. Compare to what? What are you going to compare to? Can you find out? As compared to that in phacoemulsification with OVDs alone. Correct? Then P-I-C, you got it. O, observation. What observation? What outcome measure you are going to? Yes.
Endothelial cell loss.
That is fantastic. Bhareka army. So endothelial cell loss. Okay. Endothelial cell loss. And then finally T, the time frame. Yes, fantastic. Now, immediate post-operative period. So it means you know that it's not a long-term study, not 6 months, not 1 year. This may be 1 week, 6 or 4 weeks, something like that. So not a long-term study. So in this, if you see all 5 elements, although only 1 sentence, but it expresses everything. Similarly, this was the example which I showed yesterday, since he was there in the lecture. Now, there is another published article, where the aim of the study is written in 2 sentences, and usually in any paper, where is the place to find aim of study or the research question? That is at the end of the last paragraph or the last sentence of the introduction. The aim of the study was, or the purpose of the study was. So here, again read this, and without wasting time, I will straight away go to what is the P in this. Again, in eyes having phacoemulsification. Intervention, Ringer lactate. So here basically 2 solutions are being compared. One is Ringer's lactate, and the comparison is with BSS plus. Okay. And again, outcome measure is significant difference in corneal endothelial cell loss. And the time frame is in 6 months, means it's a little longer than that. So long term, 6 months. It's written here 6 months. So it basically includes all 5 elements. So this, whenever you are starting a research, thinking of any study, first formulate a research question, whatever the baseline or the guideline that is there earlier. So follow those guidelines and criteria, and then you ultimately should try to analyze whether does it contain all 5 elements or not. Then comes, yes.
I have one question.
Yes.
How do you know the difference between I and C in BSS plus and Ringer lactate?
Yes, that is something which is that it will miss. You see, sometimes the research question will not. That's a very good question. That here, Ringer's lactate means what he is asking, that which is the intervention and which is the comparator. So basically, what is the recommended so far? Because everyone tells that everything which is recommended is balanced salt solution, because according to the all published literature, that is the ideal solution in experimental study as well as in some trials. So here, because it's a ringer lactate, means definitely I am not going to compare something which is standard compared to something which is not known at all. So I am going to, what is new here? Ringer's lactate, which is compared to standard, which is balanced salt solution. Means a standard of practice, something is which is known as standard of practice. So a standard of practice or a standard of care. Actually for this study, incidentally this is my study and so published in Journal of Cataract and Refractive Surgery. In this study from the ethics committee I had a lot of objections because there in ethics committee the other discipline doctors also sit and the basic question, one of the doctor basic question who is a real griller, his question was now that what is the standard of care, means established solution which is recommended, then no doubt balanced salt solution plus, BSS plus. Then he said, then why are you going to compare Ringer's lactate? So it was very difficult to answer that if already this is a standard of care which is established, then why do you want to compare Ringer's lactate? So for this, the explanation which I had to give, which probably I will agree immediately, that what I said, which actually we did, that we had done, means we knew that most of us, means maybe 85%, 75 to 85% practitioner, they use during phacoemulsification a Ringer's lactate in India, mainly because of the cost factor. So although it is not standard of care as per literature, but it is being used. So then I said that I had telephonically interviewed certain number of doctors and I found out that although this is standard of care, but in India, in this city where I am practicing, so many percentage of doctors are using this. So that's why this needs to be tested, that what they are doing is right or wrong. Unless I compare it with a scientific study, I cannot say for sure that what they are doing is right or wrong. If there is no difference, it means whatever they are doing is probably, means inadvertently they are doing right. If there is a difference, then it should be stopped. Correct? And then ultimately they agree. Now whenever you have got a research question, then basically all research question you have to answer in the, so it's where you are testing null hypothesis. So you presume that whatever you are comparing is, there is no difference, that is null hypothesis. And if you cannot prove this null hypothesis, it means the other alternate hypothesis means there is a difference that you have to accept. Okay? And in this there are two types of error which can occur. Alpha error, which is wrongly rejecting null hypothesis. Jatinder Bali also showed you one graph and that, so wrongly rejecting null hypothesis, or type 2 error, beta error, which is failure to reject null hypothesis. So we will not go in detail. And types of data I told you, qualitative and quantitative. Both are, you must recognize what type of data you are dealing with, because based on that you will perform the statistical test. So that null hypothesis, how will you test? You will test by certain statistical tests. Now based on, so what type of data you are having, based on that you have to choose the various statistical tests. Okay. In the numerical data, the data, if the distribution is following the Gaussian distribution, then that is known as parametric data, because it has certain characteristics, and there are different tests for parametric data and different set of tests for non-parametric data, which are numerical data but not following the Gaussian curve. Okay, is it clear so far? Now this is the simple thing, just don't get frightened with the complexity of this table. But this table, if you understand, don't try to mug it up at all. There are only 5 tables after this, including this. Once you understand the 5 tables clearly, then 90% or 95% of the statistical tests which will be required in various situations, you will be aware. Now, why it is important for you to know? If you are doing research, then you have to decide which test to be done, has to be decided before starting study. So then you will choose the proper test. You will select the proper test, but you will mention in your protocol. The second, even if you are not doing any research, but you are reading any paper, then whether the authors have done or researchers have done the correct test or not, that you will know by if you understand this basis of this, which type of test is required. Is it clear so far? Okay, now understand this table. The first question can be, is there a difference between groups which is unpaired? Means two or more independent samples drawn from the same population. Now, what do I mean by unpaired sample? Unpaired group means, suppose if I want to do some study and the population is audience sitting in this hall. Now, I am presuming there are 100 audience sitting in this hall, okay. And out of that, I can't study all 100. Otherwise, ideal thing would be that, okay, whatever I am trying to do one method in all 100, then do another method in all 100 and then see what is the difference. That will give me exact truth, which is not possible to do and which is should not be done, because if we can find out with much lesser energy and wastage of cost and time and energy, then definitely we should do that. There is only one study on this earth which required everyone's study, means to entire population. That is what? Census. Otherwise, all studies are done on small sample. So out of this 100, I will choose, say, if I want to see, just simple example, want to see effect of one medicine on intraocular pressure against the other medicine on intraocular pressure. So I will choose a sample A, suppose 10 is my sample size, so I will choose A sample B will be another 10, but these two will be different. Then I will give medicine on A, I will give medicine on B, and then see what was the previous intraocular pressure in this group, what was the previous in this, what was it after giving medicine in this group and in this group, and then compare the two. So reading of B is not getting affected by reading of A, entirely independent. These two are separate groups. This is unpaired group. So if this type of question you are answering, then this table will be applicable. And then you should know whether my data set is numerical or categorical. That's why that Jatinder also showed you that you should know what type of data you are dealing with. In numerical data, whether you are dealing with parametric or non-parametric. Parametric, how do you find it is parametric? Because one is that there is general thumb rule that if any data set which is more than 100, the total figures are more than 100, it means most likely it will be parametric. The other one is that there is a certain test which can be a statistical test to know whether my data is parametric or not. That is the ideal way. And if it is parametric, then maybe two groups, maybe more than two groups. If there are two groups, then unpaired t-test, more than two groups, then ANOVA. If the data is non-parametric.
Sir, can you explain the term parametric, please?
Parametric means the data set which follows the Gaussian curve, the bell curve. So means because the bell curve, if it is following, there are certain characteristics, specific characteristics of that bell curve. So that is parametric. So otherwise, if it is non-parametric, two groups, then man-Whitney test, more than two groups, Kruskal values. Categorical, if the data is categorical, not numerical, two groups, then chi-square or Fisher test, more than two groups, again chi-square test. If more than two groups is showing significance, then to find out, let's say suppose there are three groups or four groups, then which group is showing significance, to find out that you should do post hoc analysis. And these are the various tests, parametric and non-parametric data, that which test will be applicable to do this post hoc analysis. But this also, again, parametric, non-parametric, means these things are all pre-decided. Okay. So this table is clear. This one, table number 2. Now what is the difference here? Is there a difference between groups which are paired? Earlier it was unpaired. Now it is showing paired. So what does this mean? All other things are same. It's comparison of more sets of observations on a single such as time series, before, after, crossover. Suppose if I want to see, not comparing two, but I just want to see the effect of one medicine on intraocular pressure. So in this population, again I will choose 10 of sample, and then I will take intraocular pressure. Then again I will give the medicine. Again after whatever time period we decide, 2 hours, 3 hours, 6 hours, 8 hours. So we can take 1 reading, 2 reading, 4 reading, whatever. Based on, suppose we have taken 1 before and just 1 after, it's only 2 groups. So if that is, but here the reading of both the groups are getting affected by the previous group reading. Because whatever is the before giving medicine, based on that the 2 reading also, the second reading or third reading will be affected. So this is paired group. Okay, so this type of numeric, then after that just the same algorithm. numerical data, parametric group, two groups, paired t-test. So there is a difference. That was unpaired t-test and this is paired t-test. Okay. More than two groups, repeated measures ANOVA. There it was ANOVA. Otherwise, if it is not parametric, then two groups Mann-Wilcoxon test, more than two groups Friedman's test. Okay. Categorical data, two groups McElmar, more than two Cochrane's Q test. Same principle again here. If it is more than two groups showing positive, then then you have to do post hoc analysis to find which group was showing significance. Okay. So this is clear. The third thing, which Dr. Jatinder also showed you, that association. If you want to find out is the association between the two variables, if that case, if it is numerical or categorical, if numerical both parametric, then you have to do Pearson's correlation coefficient. And this is what he was telling, that from if the value R may be from -1 to +1, -1 and +1 both perfect correlation, 0 is no correlation, and the minus sign indicates inverse correlation, plus sign means direct correlation. And if both non-parametric, then this test. If categorical data 2 by 2, risk ratio or odds ratio, if otherwise, then chi-square trend logistic regression. Now the fourth question can be, is there agreement between the assessments? Suppose there are two examiners assessing the same individual, group of individuals, whether their marking system or standard of marking is matching or not. So how to do this? So for that, this type of test will be applicable. Or there is some new instrument, a blood pressure measuring instrument, which has been introduced into market. Then you have to compare it with the gold standard. So suppose right now for blood pressure, the gold standard is sphygmomanometer. Still that is the gold standard. There is some digital BP instrument which has been introduced, then you have to compare to that. So for that type of comparison, these things you have to use this test for numerical data, intra-class correlation coefficient. And for the graphic method is Bland-Alpin plot. Okay. If it is categorical data, then this test. Now, some of the mistakes which people commit. So this I will point out definitely here, that one is that when they are comparing two types of instruments, then two mistakes they perform, they commit. One mistake, that they take measurements from one instrument, take measurement from the second instrument, means all, whatever the sample is. So they take from all samples, entire samples, both the measurements, and then they take mean of the measurements of one instrument, mean of the measurements of second instrument, and then they do t-test, which is wrong. Absolutely wrong. The second thing what they do, that the measurements, one measurement on x-axis, other measurement on y-axis, and they try to find out the Pearson's correlation coefficient. Because that is association. Only this one, this table. So Pearson's correlation coefficient they find out, and if they get 0.91, they say perfect correlation. But that is not validation of instrument. There are certain reasons for that, which probably I cannot explain here because of paucity of time. But just remember that for instrument validation, this is the test which is performed, should be performed. The other mistake what people do, that this one, they don't understand the difference between paired t-test and unpaired t-test. They club together as t-test. So it should be, specifically it has to be mentioned whether it was done with unpaired or the paired t-test. Because t-test means we don't know whether they have done what. Okay. And based on this type of group which is to the fourth mistake which people commit, researchers, that in more than two groups, suppose there are three groups, A, B and C, then based on what type of data you have got, they should have performed either ANOVA or repeated measures of ANOVA or Friedman's test, like that, whatever. But then what they do say paired t-test between A and B, between B and C, between A and C. And then they say that all significant or all non-significant. So which is incorrect. It has to be done this way, and then if it is showing positive, then post hoc analysis. Similarly, this also means they perform ANOVA, instead of performing ANOVA test, they do unpaired t-test between A, B, A, C, C, A, or if there are four groups, A, B, A, C, A, D, then A, C, then A, so like that they go on doing it. Oh, sorry. And finally, that the survival train is a difference of survival train, especially in because it's not only survival means the person has to die before you can start doing this. So, and this is a very common graph which you must be seeing, which you must have seen in all survival curves. But that is true for anything, any event to occur. Suppose before starting study, there are certain case you have taken, and then you know that okay, now this period is going to be, this event is taking place. It means this is the end point. So how many reach that end point in 1 year, in 2 years, in 3 years? So that you draw a plot, and so that kind of study done by this type of tables. Okay. Now, yeah, how much time is there? Oh, I'll finish in 5 minutes now. How to choose right study? This is the reference. You must note down this reference. So this all 5 tables are given there in the editorial. It's only 2-page editorial, and you will understand. So that's why I said don't try to mug up or don't try to means this that is available on, it's freely available on Indian Journal of Ophthalmology website. And statistics is the only science where different conclusions can be drawn by different statisticians using the same set of data. That's why we must understand these tests, and that's why the value of triple blind study. And this, I think I will bypass. These are 10 points which is written, 10 ways to cheat on a statistical test when writing up results. So this I am putting up here, not that you should do, you should learn how to do it. But if someone has done it, then you should be able to pick up, because many people do it. And in this only he has asked me to also talk little about the dangers of post hoc analysis. So in this one point is that throw all your data into a computer and report as significant any relation where its p-value is less than 0.05. So this is also something like post-hoc. You have not decided what to do, but then you just did something. Or there is another one which is, where is it? Chinese population. Yes. If your results prove uninteresting with the statistical test that you had decided before starting the study, ask the computer to go back and see if any particular subgroups behave differently. You might find that your intervention worked after all in Chinese women aged 52 to 61. And then you say it is significant, it works on this. In others it doesn't work, but it works on this. So these things are all wrong. And then you come to ethics and research. As per the Oxford Dictionary, because there cannot be any definition of ethics, there cannot be any fixed guideline for ethics. Because, see, the ethics, what is the dictionary meaning? The moral principles governing or influencing conduct. So no one can define that what these things are included and these things are excluded. And what is moral? The meaning is concerned with principles of right and wrong behavior and the goodness or badness of human character. But there is nothing which is universal. Even this, one may be bad at one place, may be good at another place. I'll give you one example. If I murder someone, I am a criminal. Okay, it's true or not? In all situations? Yes or no? No, where no?
Self-defense.
Yes, defense. So in defense, someone who is murdering someone, is killing someone, he is not a criminal. Rather, he is a hero. So he is doing the same act, but at one place means it's moral, other place it is immoral. Okay. So then no one can really define that what is moral. That it all comes from inside, and all means anyone can, not like politician, you do anything and everything you try to prove that everything is moral. But finally in any research means what according to morality is be honest. Do not harm anyone. That is the basic ethics of any research. That when you are doing research, don't harm the patients or subjects. Freedom to the patient should be always given. But for inclusion in the study, any time in between the study also, if he wants to get away from the study, you cannot force them. You should not lure that patient that okay, you complete the study, I will give you this lollipop. No, that is absolutely unethical. Then risk to privacy, because you cannot risk his privacy. All patients, whatever medical records, everything, or disease or whatever, everything is privacy. You should not disturb. So that also you have to. That's why in our hospital, that was one of the NABH requirements. That in all lifts, it is written here, doctors, please don't discuss the patient's condition in the lift, because then there are other people also listening in the lift. They will hear what you are talking and perform research with a purpose. Because without any purpose, you don't think that it's going to serve any purpose, it's useless. And this is, again, it becomes unethical. So, but any research these days, it has to get ethics committee approval. And study design and level of evidence, I will quickly see the sequence of investigations: descriptive, analytical and experimental. And this is all looks very complex, but mainly it's it can be either descriptive or it can be analytical. In descriptive, the main studies which are the sample survey, case study or the census. In analytical, observation where the prospective, cross-sectional and retrospective. So in this one, basically observation, analytical observation, there are three studies which are very, is probably known and well known: case control, cohort and cross-sectional. And the experimental study, again, the RCTs,